This was a retrospective study, and we looked at essentially all patients at our center that got any CAR T-cell product that was a CD19-specific CAR T product for diffuse large B-cell lymphoma, transformed follicular lymphoma, primary mediastinal B-cell lymphoma, and high-grade B-cell lymphoma. And we specifically looked for individuals that had evidence for progressive disease, either immediately after their CAR T-cell therapy. Generally, folks will get staged again in 28, 30 days or so. And then we also looked at individuals that had late progression of disease, meaning they had evidence for complete response or partial response or stable disease initially, but then later on had evidence for progression of disease. So we identified these individuals and looked at their outcomes. When we looked at all of our patients who had evidence for progressive disease, we identified 58 patients, and their overall survival was a median of a little bit over 5 months. And this is taking into account both the early and the late progressors, which is not a great outcome. Certainly, we can be doing more to help support our patients and hopefully improving CR rates and also decreasing progressive disease rates. When we looked at the overall survival outcomes, when we separated the two groups, there was a difference in overall survival. Those who had early progressive disease did not live as long, somewhere in the 3 to 5 month range, I would just call it. And those who had evidence for delayed progression lived a little bit over a year from a median overall survival standpoint. And so it would suggest to us that those who had delayed progressive disease probably had some additional time to think and plan about what types of therapies could be used next, and certainly is also indicative of maybe the disease biology in those individuals potentially were less aggressive. These are all hypotheses still, and hopefully will generate some clinical trials that will help us figure out these questions a little bit more.